Picture this. You're sitting in a doctor's office, for a routine pelvic exam. The doctor inserts the speculum, takes a look, and casually mentions that your tissue looks friable.
Right, which sounds terrifying if you don't know what it means.
Exactly. I mean, outside of a medical clinic, friable is actually a fantastic word. You usually hear it in, like, a bakery. It describes a perfectly baked croissant or some delicate pastry that easily crumbles and flakes apart in your hands.
Yeah, a very different context.
Very different. Because in a clinical setting, specifically regarding the cervix friable, is absolutely not a word that implies something delicious. It means the tissue is incredibly fragile. It means that just, the gentle brush of a cotton swab is enough to make the tissue tear, slow off, or just start bleeding.
And it is a very vivid physical symptom. I mean, it immediately plunges a clinician into some pretty muddy diagnostic waters. Because when a doctor sees mucosal friability, they aren't looking at a disease itself, right? They are looking at a highly localized distress signal.
Like a check engine light for the body.
Exactly. The delicate, highly calibrated environment of the cervix has been altered. But the reason for that alteration, well, it spans a massive spectrum.
And that is the exact mission of our deep dive today. We are exploring the clinical significance of mucosal friability during a routine speculum examination. Basically, when a doctor looks inside and sees tissue that bleeds just from contact, what is the body's underlying biology actually doing?
It's such an important question to decode.
It is, because hearing the phrase bleeding tissue triggers immediate panic for most people. But as we strip back the layers of how this part of the anatomy functions, you realize it is often just this fascinating biological response to the environment.
Yeah, to understand why this tissue becomes so delicate, you first have to kind of visualize how it's constructed. The cervix isn't just one uniform piece of tissue. It is a transition zone between two very different cellular worlds.
Okay, two different worlds. Break that down for us.
Sure, so you have the inside canal, the endocervix. This is lined with columnar glandular cells. They are a single layer thick, highly vascular, and very delicate because their main job is just to secrete mucus.
Right, so they're built for production, not protection. It's very similar to the delicate tissue on the inside of your cheek or your lips.
Precisely. It's meant to be protected. But then you have the outside of the cervix, the ectocervix, which projects into the vaginal canal. Now, this area is covered in squamous epithelial cells.
And those are the tough ones, right?
Yeah, they are tough, flat, and layered like shingles on a roof. They are specifically designed to handle friction in the naturally acidic environment of the vagina. So friability often happens when the boundary line between those two types of cells shifts.
Which brings us to a really common condition called cervical ectropion. And this is entirely benign, right?
Completely benign, yeah. It happens when those delicate glandular cells from the inside of the canal actually grow outward. They spread onto the tough external surface of the cervix.
The analogy from the sources that I love is if you roll your bottom lip outward, exposing that soft red inner tissue to the dry outside air, that is the perfect mechanical analogy for what is happening.
It's a great visual because suddenly cells that were never meant to experience direct friction or high acidity are just totally exposed.
And they react exactly how you'd expect, right?
Yeah, they appear beefy red, raw, and they bleed at the slightest touch. But what drives that migration is pure hormonal engineering.
Yeah.
Estrogen is really the grand architect here. High levels of estrogen actively stimulate those glandular cells to proliferate and march outward.
Oh, wow. So anytime a person experiences a surge in estrogen, whether they're pregnant, going through puberty, or, simply taking a combined oral contraceptive pill, they're physically restructuring their anatomy.
Yes, exactly.
That's wild. The birth control pill is essentially telling those delicate inside cells to move to the outside, creating a friable surface.
Yeah.
It is crazy that a daily pill mechanically alters the structural resilience of your internal organs.
It really highlights how dynamic the reproductive system is. And during pregnancy, for instance, you don't just have that cellular migration. The hormones massively increase the blood supply to the entire pelvic region.
So it's getting more blood flow on top of the delicate cells moving outward.
Right. The cervix becomes incredibly engorged with newly formed, fragile capillaries. That heightened vascular state means the tissue is primed to spot or bleed from just mild irritation.
So it's a natural, healthy adaptation for supporting a pregnancy, even if the friability itself looks alarming on an exam.
Exactly. But, the pendulum swings the other way, too.
Right, because we know high estrogen builds up these delicate cells and pushes them outward. So when estrogen plummets, you'd logically think the tissue might get tougher, But the reality is the exact opposite.
Yeah, it's a completely different kind of structural failure. During menopause, the lack of estrogen leads to vulvovaginal atrophy. The entire defensive structure completely collapses.
And why is that collapse so severe?
Because estrogen doesn't just grow the delicate cells, it also maintains the tough ones. Without it, the vaginal wall physically thins out. The mature, tough, squamous cells at the surface are replaced by what we call parabasal cells.
Thrabazole cells.
Yeah, think of them like the raw, wet mortar of a brick wall before the actual bricks are laid. They are immature, round, deep layer cells that just haven't flattened out into protective shields yet.
And it isn't just a structural failure, it's a chemical one too, isn't it? Because estrogen normally fuels the production of glycogen in the tissue.
Right, which acts as a food source for lactobacilli, the good bacteria in the microbiome.
And those lactobacilli eat the glycogen and pump out lactic acid. That keeps the vaginal pH highly acidic, usually under 4.5. That acid is basically like an invisible electric fence keeping pathogens out.
But when estrogen drops, the glycogen vanishes, the lactobacilli starve and disappear, and without them, the pH rises, becoming much more neutral, sometimes approaching a 7.
Wow, from under 4.5 all the way to 7.
Yeah, a massive shift. So you are left with a microenvironment that has no chemical defense and a structural wall made of fragile, immature cells that completely lack natural lubrication.
So inserting even the smallest pediatric speculum during an exam can cause the tissue to crack, form tiny fissures, and bleed. The friability is just profound.
It is. So in the cases of ectropion, birth control, pregnancy, and menopause, the friability is entirely mechanical and hormonal. The body is just adapting to its internal signals.
Okay, so that's the structural and hormonal side. But let's look at what happens when the wall is perfectly built, the hormones are balanced, and yet the tissue is still fragile and bleeding.
Right. This shifts the conversation from anatomy to microbiology. We are talking about cervicitis.
Which is active inflammation of the cervix caused by an invader.
Exactly. When a pathogen attacks the cervical tissue, the body responds by sending fluid and immune cells to the area. The tissue swells, a state we call edema. The blood vessels dilate to allow those immune cells to arrive faster, which makes the vessels stretch and become incredibly vulnerable to tearing.
Now, a really common intuition here, and something you listening might be wondering, is how someone could have an actively bleeding, inflamed cervix from an infection and not feel it.
It's a very logical question.
Right. Because if a foreign pathogen is attacking your tissue to the point of structural failure, shouldn't there be excruciating pain? Shouldn't there be massive physical red flags before a doctor ever uses a swab?
It totally seems counterintuitive, but the data proves otherwise. Up to 80% of cervicitis cases are entirely asymptomatic.
Wait, really? 80%?
Yeah. The patient feels absolutely no pain, notices no unusual discharge, and has zero systemic symptoms.
80% is a massive blind spot. Why is the body so quiet about it?
It really comes down to evolutionary wiring. The cervix does have pain receptors, but they are primarily tuned to detect deep pressure and stretch.
Which is obviously vital for childbirth.
Exactly. They are not highly sensitive to localized surface irritation or the kind of inflammatory damage caused by bacteria. You just don't have the same dense network of tactile pain receptors there that you do on, say, your fingertips.
Which makes spotting friability during a routine exam an incredibly vital piece of detective work. It might be the absolute only clue that a silent infection is spreading.
And that's so important because if something like chlamydia goes unnoticed, it doesn't just stay in the cervix, it ascends.
It moves up into the uterus and the fallopian tubes, causing pelvic inflammatory disease, which can permanently scar the reproductive organs and even lead to infertility.
That's why clinicians take a friable cervix so seriously. When we look at the specific culprits, sexually transmitted infections are usually the primary suspects. Chlamydia and gonorrhea typically present with significant cervical swelling and a mucopurulent discharge.
Right, which is a thick, yellowish fluid consisting of mucus and dead white blood cells.
Yeah, it's a sign of active infection. Then you have pathogens that leave a highly specific physical signature, like trichomoniasis.
Which is a parasite, right?
Correct. It's a parasitic infection, and the parasite physically damages the tiny capillaries on the surface. It creates these tiny, localized microhemorrhages.
And the medical community calls this the strawberry cervix because the tissue is dotted with these vivid red bleeding spots.
Exactly. And then you have the herpes simplex virus, which behaves differently. It directly attacks the epithelial cells, causing them to balloon and eventually burst.
Leaving behind those tiny vesicles, fluid-filled blisters or painful ulcerative lesions that slough off easily.
Yeah, it's very destructive to the surface layers.
But the bleeding isn't always caused by a sexually transmitted pathogen. A really fascinating section of the source material explores how sometimes the danger comes from an imbalance in the natural environment itself, a state of vaginal dysbiosis.
Right. Dysbiosis occurs when the natural hierarchy of bacteria just breaks down. We talked earlier about how lactobacilli maintain that protective acidic environment.
Yeah, the invisible electric fence.
Right. Well, if they're wiped out, perhaps by a broad spectrum antibiotic, extreme stress, or aggressive, douching, opportunistic bacteria that normally live there in tiny, harmless numbers suddenly multiply rapidly. We're talking about species like Gardnerella or Ureaplasma.
And the Sriracha Clinic actually conducted a very revealing study on this. They looked at 40 women suffering from chronic recurrent cervicitis, meaning their cervix was continually inflamed and friable, even after standard treatments.
It's a huge problem for those patients.
It is. And the researchers used highly advanced multiplex PCR testing, which looks for the exact DNA of the bacteria. And they found that in 70% of those cases, the driving factor was not an STI.
No, it was overwhelming dysbiosis, primarily dominated by Gardnerella and Ureaplasma.
What's crucial to understand is how these opportunistic bacteria cause such chronic fragility. They don't just passively occupy space.
Right, they create biofilms.
Yeah.
And they release enzymes designed to break down cellular walls so they can scavenge nutrients.
And the body detects this chemical smog.
Right.
And it floods the tissue with white blood cells to fight back.
Exactly. When pathologists look at a swab of this under a microscope, they evaluate the severity by counting the white blood cells. If they see more than 10 pus cells per high-power microscopic field, it confirms active, severe inflammation.
And that inflammation is highly destructive because white blood cells destroy bacteria by releasing reactive oxygen species, which are essentially highly corrosive chemicals.
It's biological friendly fire. The crossfire between the multiplying bacteria and the aggressively defending white blood cells completely degrades the delicate epithelial tissue of the cervix.
So the friability is just a physical manifestation of that sustained chemical breakdown. Wow.
Yeah, it's a microscopic war zone.
Okay, so we've established that hormonal shifts can alter the architecture and that bacteria or parasites can degrade the tissue. But we have to address the most concerning possibility here.
The elephant in the room.
Right. What happens when the cells themselves undergo a fundamental, dangerous alteration? Because a friable cervix can also point to cellular abnormalities, ranging from benign growths to precancerous lesions and ultimately to cervical carcinoma.
Yeah, starting on the benign end of that spectrum, we look for cervical polyps. These are small, elongated tumors that protrude from the cervical surface or canal.
And they are usually completely harmless and non-cancerous, right?
Mhm. They are, but they are essentially dense bundles of hyperplastic glandular tissue fed by a very prominent, very fragile blood supply. So even the slightest friction during an exam or intercourse will cause those tiny vessels to rupture.
Got it. But then we step into significantly more dangerous territory. Cervical intraepithelial neoplasia, or CIN. This is abnormal precancerous cell growth, primarily driven by long-term infection with high-risk strains of the human papillomavirus, or HPV.
And the way HPV alters the tissue mechanics is truly fascinating. It operates by hijacking the cellular division machinery in the basal layer of the cervix.
The very bottom layer.
Right. Normally, a cell is born at the base, it slowly matures, flattens out, and joins the tough protective outer layers. But HPV stops that maturation process. It forces the cells to multiply rapidly as these disorganized, immature blobs.
And because they never mature, they never form the tight structural junctions that hold healthy tissue together. It's like a building contractor just piling up loose bricks without ever adding mortar or a roof. The structure is inherently unstable.
That's a perfect way to put it. Plus, these rapidly dividing precancerous cells demand a massive amount of oxygen and nutrients, so they force the body to grow fragile, chaotic, new blood vessels to feed them.
So the combination of loose cell structure and that chaotic blood supply makes the area incredibly friable.
Exactly. And if CIN is not identified and treated, it can eventually break through the basement membrane and become true cervical carcinoma cervical cancer.
And how does that actually present during an exam?
It's wildly variable. Sometimes it is glaringly obvious. A doctor might see a large, raised, heavily vascularized lesion that bleeds profusely. They might see deep ulcerations or even tissue necrosis, where parts of the tumor have outgrown their blood supply and actually died.
But the terrifying reality of cervical carcinoma is that it can also hide, right? A cancerous cervix can look absolutely perfectly normal to the naked eye during a visual speculum exam.
It can, which is scary. This happens when the tumor is growing deep within the endocervical canal, hidden from view, or it's infiltrating the deeper stroma of the tissue rather than growing outward on the surface.
So the friability might be subtle or
Like
just completely non-existent.
Exactly. The cancer might only be detected in later stages during a bimanual exam. That's when a doctor uses their hands to physically palpate the cervix and surrounding pelvic organs.
And what does that feel like?
Instead of feeling mobile and firm like the tip of a nose, which is normal, a cancerous cervix might feel rock hard, massively enlarged, and rigidly fixed to the surrounding pelvic walls.
When you lay it all out like that, it's a staggering diagnostic puzzle. I
Yeah.
mean, if you go in for a routine checkup and a doctor notes mucosal friability, it could mean your estrogen is just high because you're pregnant. It could mean your estrogen is low because you're in menopause. You could have a completely painless STI. You could have an overgrowth of normal bacteria. Or you could have precancerous cells actively restructuring your tissue.
It's a massive spectrum, yes.
So how does the medical community take all that ambiguity and actually crack the case?
Well, because the visual symptom is just a blaring alarm, clinicians rely on a highly specific toolkit to systematically rule out the life-threatening causes and pinpoint the treatable ones. It always starts with sampling the environment.
Right, the swabs. The first step is usually molecular testing, specifically a NOTAT or nucleic acid amplification test.
Yeah, they use a swab to collect a tiny sample of fluid, and the laboratory then takes that sample and looks for the highly specific genetic signature, the DNA or RNA of pathogens like chlamydia or gonorrhea.
And even if there are only a few copies of the bacterial DNA present, the test chemically amplifies them millions of times so they can be definitively detected. It completely removes the guesswork of a silent infection.
It's incredibly accurate. Now, for environmental or hormonal issues, they analyze the chemistry of the vagina itself. A doctor will often perform a wet prep, smearing vaginal secretions on a glass slide with a drop of saline to view directly under a microscope right there in the clinic.
And they check the pH too, right?
Yes. If the pH is high, and the microscope shows a field devoid of lactobacilli but flooded with those round, immature parabasal cells we discussed earlier, well, it confirms severe atrophy.
The diagnosis is structural failure due to a lack of estrogen.
Exactly. Or if the slide is covered in a massive swarm of white blood cells, they know they have to treat an active inflammatory dysbiosis.
But the most critical part of the toolkit is designed to rule out cancer. A routine pap smear physically brushes cells off the cervix to look for microscopic architectural changes, usually paired with a high-risk HPV test to see if the viral trigger is present.
And if those tests show abnormalities, or if the friability itself looks deeply suspicious during the exam, the doctor moves to a colposcopy.
Which is essentially a high-powered binocular microscope used to examine the cervix in extreme detail.
Right. And during the procedure, the doctor often applies a dilute acetic acid solution, basically medical-grade vinegar to the tissue.
Vinegar, what does that do?
Well, abnormal precancerous cells have a very high nuclear density, and the acid causes those specific proteins to temporarily coagulate and turn stark white. It creates a literal physical map of the danger zones.
That is amazing. So once they identify those white abnormal areas, they can take targeted punch biopsies, removing tiny pieces of the tissue to send to a pathology lab.
Yeah.
And that is the only way to definitively rule in or rule out cancer.
Yes, the biopsy is the gold standard. And once the specific underlying cause is identified, the treatment is highly tailored to the mechanics of the problem. Bacterial pathogens are eradicated with targeted antibiotics. Fungal overgrowths are cleared with antifungals.
And if the root cause is structural like menopause, the fix is often localized hormone replacement therapy.
Yeah, HRT.
By applying topical estrogen creams or rings, you reintroduce the hormone directly to the tissue. It reignites glycogen production, feeds the lactobacilli, restores the acidic shield, and triggers those fragile parabasal cells to finally mature into tough squamous layers again.
It's a complete restoration of the ecosystem. And if the friability is caused by a polyp, well, it's simply grasped and twisted off. Interestingly, though, for severe benign friability, like a stubborn ectropion that causes constant spotting and distress, clinicians sometimes use a chemical approach like silver nitrate.
Silver nitrate is fascinating. It's essentially a chemical spot welder.
It really is.
When applied to the raw, bleeding tissue, it delivers silver ions that instantly bind to the proteins in the tissue. This causes a rapid chemical reaction that coagulates the cells and seals the tiny bleeding vessels, creating a sterile eschar, or basically a scab.
Yeah, it burns away the fragile, overgrown layer and forces the body to lay down fresh, tougher squamous cells as it heals.
It's an elegant physical reset for the tissue. And it brings us back to the core reality of mucosal friability. It is not an endpoint. It is an invitation to investigate the local microenvironment,
I couldn't agree more.
which completely reframes how you should view this symptom. Bleeding tissue sounds inherently bad, but it is just your body's early warning system operating exactly as it should. It is signaling that a complex hormonal, chemical, or cellular balance has tipped.
And that biological signaling system is incredibly resilient.
It really is, and that leads to one final deeply provocative concept from the sources regarding how our bodies manage this tissue damage, because we spend so much time talking about outside invaders, antibiotics, and chemical treatments.
Yeah.
But human tissue actually contains its own internal pharmacy.
Oh, absolutely. It's a critical piece of the puzzle. Healthy mucosal tissue is constantly producing its own anti-inflammatory compounds, specifically molecules like prostaglandins and localized corticosteroids.
And their primary biological job is to act as natural medicine, to moderate the immune response, repair irritated cells, and prevent the exact kind of runaway inflammation that causes friability.
Which raises an incredibly compelling question. When we see a friable cervix due to dysbiosis or hormonal shifts, how much of that is the sheer force of an outside attack, and how much of it is the body simply running out of its own biological medicine?
Right. What happens when our internal capacity to produce those anti-inflammatory corticosteroids is exhausted by chronic stress or environmental factors? Does the tissue become fragile because the invader is too strong, or because our own internal pharmacy has just run dry?
It forces us to look beyond just killing a bug or applying a cream. It challenges us to consider how we support the body's natural baseline of healing and immune resilience.
It's a fascinating perspective to carry forward. So the next time you hear the word friable, whether you are ordering a delicate pastry or you find yourself navigating a doctor's appointment, you know exactly what is happening beneath the surface. You understand the structural shifts, the chemical environments, and the cellular mechanisms at play. It isn't a reason to panic. It is just your body asking you to look a little closer at the environment. Keep wondering, keep investigating, and we'll catch you on the next deep dive.